The World Health Organization is part of the United Nations system. There's the main United Nations that we all know that has the Security Council and the General Assembly meetings. But under that are a whole series of organizations and agencies that deal with specific parts of the world. One of them is the World Health Organization. They were all set up in the late 1940s and early 1950s.
Today is WHO's birthday.
WHO in kind of non-pandemic times is basically to help out the parts of the world that need help, that don't have the resources, the money, the expertise to promote public health, to help them establish systems, to give them access to technology and to medicines. When there's a health emergency, the World Health Organization is supposed to coordinate things. It is, again, supposed to help with the distribution of resources. It's supposed to monitor and generally organize the world to deal with the crisis. President Trump believes that as the Chinese supposedly did not give out enough information and accurate information about what was going on in China, how serious this was, how extensive it was.
The World Health Organization is very China-centric.
There's reason to believe that the Chinese underplayed what was going on, how it came about, what the spread of it was. They weren't sharing, at least initially, with the world the information that they had, and that the WHO pretty much took them at their word. At the same time, when President Trump announced that he was going to close all travel, incoming travel to the United States from China.
This is a serious health situation in China, but I want to emphasize that the risk to the American public currently is low.
The WHO said they didn't think that was the best thing to do.
They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China.
Now that was pretty standard for international health organizations, that closing borders will impede the ability of medical experts to go check out for themselves and to share information and gather information. So I think that President Trump has interpreted that as part of a WHO effort to protect China and to protect its version of events.
We regret the decision of the President of the United States to order a hold in funding to the World Health Organization.
I don't think anyone thinks this was the WHO's finest hour, but they do have a pretty good track record, and they do a lot of good things in a lot of good places. And what I think kind of global opinion is, and some opinion in this country, is that now is not the time to be punishing the WHO and trying to hold it back, that in fact the world really does need it.